today. It is on the implications of health inequities for health promotion and public health policy. You are joining a webinar that is being jointly offered by National Collaborating Centre for Determinants of Health and also Health Promotion Canada, who will be talking a bit about their organization. I'm Diane Oikel. I'm Knowledge Translation Specialist with NCCDH. I've been here for over 5 years now, and in the background is my brilliant colleague Asha Cortete, and she is participating from her home office in Montreal. And as you know, we are one of 6 National Collaborating Centres for Public Health. We are spread across the country. Our NCC for Aboriginal Health, which you'll see at the top of this map, is located in Prince George, BC, and I want to acknowledge that they've actually changed their name to the National Collaborating Centre for Indigenous Health. We have just yet to replace that logo on this graphic. So their webinar or their website is NCCIH.ca, and I want to apologize for the inaccuracy, but acknowledge that they've definitely changed their name. And before we go any further, I want to genuinely acknowledge that the NCCDH is located in Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. So I sit at St. Francis Xavier University, which is our host institution, and we are in Antigonish, Nova Scotia, which is in Mi'kmaq. And this is meaningful to me to do every single time that I do this acknowledgement. And so I encourage you to do this in your work when you're in your own home space, but anytime you're out representing your organization and yourself at other locations. So whenever we are in other cities or communities across Canada presenting, we will still acknowledge the land where our office sits and give thanks to that. And because we are a national organization, I want to extend this respect and recognition to all First Nations, Inuit, and Métis communities and nations across the country. And this is us, National Collaborating Centre for Determinants of Health. Our website is NCCDH.ca, and please go to the website for lots of great resources and information. So this is our webinar objectives. We do have an evaluation link at the end of the webinar, and I'll ask you to think about these objectives as you go in to do the evaluation. I will apologize for the spelling errors in the last bullet point, which should read, discuss strategies to increase community influence on public health program decision making. You can comment on that in the evaluation if you want, and that was absolutely my error. The goal of today is to really look closely at how we influence health inequities from a policy perspective, and in this time of health system reform, we need to do that, and we need to figure out ways to work together to do that in an area that we're sometimes feeling a little lost. And we have 2 excellent speakers today. I can't believe how lucky I am sometimes. We will hear from Dennis Raphael, who is at York University, and also we will hear from Sionnach Lukeman, who is here at St. Francis Xavier University, although not in the same room as me. We've got different spaces right now, and I will tell you a little bit more about each of them when we get to their respective contributions and presentations. And with that, I am going to hand the reins over to my colleagues at Health Promotion Canada to say a few words about their organization.
Great. Thanks, Diane. So I'm just going to do a little bit of an introduction, then I'm going to hand it over to Irv. My name is Leslie Dyke. I am a health promotion consultant who used to work with the National Collaborating Centre for Determinants of Health, and so it's lovely to be on this webinar and to see a lot of familiar faces in the chat box. So it's great to be here. I want to begin also by acknowledging the Syilx Okanagan Nation and their peoples in whose territory I have the privilege of living and working here in the Okanagan Valley in British Columbia, and to recognize that this is unceded territory. So Health Promotion is really pleased, Health Promotion Canada is really pleased to partner with the National Collaborating Centre for Determinants of Health on this webinar series. And we have volunteers from all across the country. And today I'm going to be doing a little bit of an intro, and Irv is going to talk a little bit about the 4th edition of Health Promotion in Canada in just a moment. So Health Promotion Canada, we're working to connect everyone engaged in health promotion in Canada. And I won't go into all of the background detail of what we do, except to say that we're particularly interested in creating cross-sector, cross-discipline types of connections, because as we know, health promotion is not the purview of simply people that have a health promoter in their titles. So we're really looking to make some connections. And as I mentioned, we have a group of volunteers, and we take on a number of different tasks and jobs and work to keep the organization going. So we're a network of volunteers. We work nationally, but we also work in our own regions. So there's a group working near you. If you're interested in getting involved, we'd love to chat with you some more about getting involved with us. You can get information about Health Promotion Canada on the Health Promotion Canada website. Lots of resources to access there, but in particular the Health Promoter Competencies Toolkit I would point out, because it has some very specific tools for managers. For example, if you're working to develop job descriptions or undertaking evaluations for health promotion staff, there's some really good resources that you can get access to by being a member. And of course, we have lots of activities going, but I just want to point out one that is top of mind right now, because today is the actual last day for applications for the awards program. There are 7 categories, and if you know someone or you're part of a team that are doing some excellent work related to health promotion, we'd love to see your application in here. But you do have to do that the minute you get off this webinar, just saying. That's because the deadline is today. I think that's about it. I'm going to hand it over to Irv, who's going to talk a little bit about the 4th edition of Health Promotion in Canada, which formed the foundation for this webinar series.
Irv, you might be muted. Maybe press #6.
Is it #6 or *6?
I think it's pound to unmute.
Okay.
I think it can be either. So I'm going to assume that Irv will get connected, but I can also just provide a little bit of introduction to keep us going.
Sure.
So Irv is, as many of you know, he is we consider him to be a founding father of health promotion in Canada, and he was involved in the creation of the Ottawa Charter. And he's been instrumental in creating and revising Health Promotion in Canada, which the 4th edition is now available. And so one of the things that we did when we were thinking at Health Promotion Canada around developing some webinars, we thought it would make a lot of sense to connect the different chapters in Health Promotion in Canada to the webinar series. And of course, Dennis is one of the authors that is represented in the resource, and I'd really encourage you to get a copy of the resource if you haven't already. And there is also an instructor's manual, which Irv will have more information about. So if you're using it for any kind of teaching purpose, there is an instructor's manual that will go with it. So here on this slide is just an example of a few of the chapters that we've profiled, the authors, and if you want to get copies or you want to listen to the webinars, they were recorded and they are available through the National Collaborating Center for Determinants of Health. So we're just really pleased that we have had the kind of engagement, and we really want to thank the authors who have also come on the webinars to share their thinking and expand upon it. And of course, Irv wouldn't fail to express thank you as well to the Canadian Scholars Press. They've been an exemplary partner, and they've also provided in the past some free copies of Health Promotion in Canada. So again, if you have any questions about it, you can get some information from Irv around getting copies of that particular resource. So I think that sums up the Health Promotion Canada perspective, and I'm just going to hand it back to Diane.